PA students out there, these are the pet peeves of your preceptors on rotations right now on the PA Startup Podcast. If you have other ones that we don't mention here, mention them down below in the comments. How's that for an intro? Pretty good.
Yeah, it's great.
Did you like it? Just came from work. Just got my badge on.
Yeah.
All right. So students are a fact of life, right? That's the whole reason. We love them.
And hate them.
We don't always love them.
And I'm sure people hated us, maybe. I mean, I feel like I was a decent student.
Never. I had a good rotation experience, but in hindsight, I think there were a couple things I was missing. And now that we are on the other side, I think you and I agree we have had some students who are stellar, which is great, but we've also had some students who are not so stellar. And so I think it's important for PA students to know what we would call a pet peeve.
Yeah.
Right?
What are the things to avoid? Maybe or habits or simple things. I mean, there's personality differences and you can't fix that. You are, you are. Don't pretend to be someone you're different. Right. I mean, certain personalities fit better in certain types of practices. So be who you are. There's certain things you can do or not do that would leave a different impression.
You can put your best foot forward.
Correct. So these are maybe some of those things.
These are things that you need to, if we're going to put our best foot forward, these are the things you leave in the back behind everything else. So my one, and I don't care who starts, but I guess I'm going to.
First one that comes to mind.
The one that gets me the most is when people say, I know.
Oh, terrible.
So let me set up the situation. We're in surgery. Okay, no. Pulling a chest tube. Okay. Patient is awake in bed and I'm coaching someone through how to do it. And they are doing the wrong thing. And I say, no, what you need to do is do this. And they say, I know. And they just keep on doing the wrong thing. Not the right answer. The answer is never.
Because you don't know. And it's okay not to know. Right. I mean, even as a practicing PA, when you're learning how to do things, it's the same rule of thumb. You don't know. Right. So there's times to project confidence, like I know these things and I'm going to help take care of these things so that your doctor or your partners know that you can do it. But if you don't know, for the patient safety as a provider, but as a student, just so you don't look stupid, I don't know. Yeah. The expectation isn't that you know everything. So it's okay to say, for sure, you know what, thanks, or okay, or sounds good, anything other than I know. I agree. That's huge.
I think people are trained like, I don't want to say I don't know. So I want to fake confidence, or I want to pretend like I know. But then what ends up happening is you ramble or you say something, that's just setting you up for more criticism. But more importantly, if I'm telling somebody something like, no, you need to do it like this, it's because you're doing it wrong. And so for you to say, I know, and to keep going, why do you think I'm saying this to you?
How many times have you, I've been in the operating room. You were talking about something on the floor, but in the operating room, working on suturing skills, right? Okay, so you had a class that taught you how to do it. No one comes out of PA school or into rotations who is an expert at
a stellar sewer
at sewing. Never. Anything, right?
Right.
How many times have you been in the OR? I mean, I can think of a few off the top of my head where you say you need to do this or do that. I know.
Yeah. Hold the needle holder this way.
It's
grab
not
the
even
needle
just
here.
You. It's you, the surgeon that hears it, the techs that hear it, the anesthesiologist, and everyone in the room knows that you don't know because you're holding the needle driver upside down and backwards. So don't say, I know. Yeah. No, you don't. Just say, okay, and move on. Take it. Okay, this is a point of learning. That's what you're here for, is to learn. Right. Move on. I respect students way more when they come in, hey, I don't know anything about the specialty, I know what we learned in school, so I'm an open book. Teach me. Open to criticism, open to whatever, because those people are the ones that are malleable in terms of what they could become, right? If you're looking, especially if you're in a specialty rotation that you want to get a job in, like maybe you're an ortho, like never say I know.
Right.
Right? Because you don't know. You want to learn as much as you can, and you want to set an expectation for that doctor that I can train this person to do things, and they're going to listen.
Right. Yeah, you have to be moldable or malleable, like you said. You have to take direction and then adjust. But when I'm telling you in your ear, hey, that suture needs to go over there, I know. Number one, why am I saying it? Number two, why aren't you changing what you're doing?
Yeah.
The correct answer, in my opinion, is okay or thank you. Even if you know. This could be something you know. I could say the sky is blue. And for you to say, I know, wrong answer. If you say, okay, thanks.
Silence is better.
Yeah.
Hey, dude, that's not right.
Or,
okay.
You could say anything other than I know. I don't know why it bothers me so much. I think in training new PAs, there's always a little bit of a wall. Like the learning curve, it's like steep at first, and then you think, I kind of have this figured out. And then the honeymoon period wears off, and people aren't quite as patient with you, and it kind of sinks down the other way, and then it comes up again. And so when you're in that lull, that's when I'm usually in people's ear. And I remember telling a lot of people that I'm going to tell you the same thing over and over and over, so that when you get to this point in the case, you hear me say that. And so the second time I tell you, if you're like, I know you know, or...
And I'm going to keep telling you.
Yeah, I'm going to keep telling you that. So, okay, moral of the story, I know, out the window.
Out the window.
Don't say I know.
I'm going to piggyback off it.
All right.
One thing that bothers me, and maybe is a thing that you can learn to say, is I don't know.
Sure.
Meaning, when you're asked a question as a student, you're going to get asked 1,000 questions that you didn't ask the patient. Let's say you're hypothetical, you go in, hey, I want you to go see this patient, pre-round on the patient, and do, your H&P or do your progress note, and then we're going to round in a group. That's typically how rotations in big teaching facilities go, sure. Right? So you walk around with the provider, and they say, so this patient is this, and they ask you a question. Crap. You didn't ask that question. Mm-hmm. Now all of a sudden you're on the ball. How do I answer? It's okay to say, you know what, I don't know.
I don't know. I didn't
ask. Yeah. Instead of the annoying thing, which is making something up or saying, yes, I think so. No, I don't think so. Because what happens is we're going to find out whether or not something is or is not happening with that patient. It's better as the student to just say, you know what, I don't know. Mental note. Ask these questions for the next time. So the next time you do rounds, you're going to know the answer to those things rather than say something false. Yeah. Because what I remember about people that do that is you're just wrong, or you're lying, or it paints you in a poor light. Yeah. Projects you in a poor light, I think.
It hurts your integrity. Because if you're going to kind of lie to me, if I say, hey, how were their pulses in their feet? And you're like, they were equal. And I go in there and they've had an amputation. Clearly you didn't look. And the other thing to piggyback on your piggyback is then people that make excuses about it. Mm-hmm. Well, I thought you meant the leg that was remaining. No, you didn't. Nor does it matter. Like, don't ever make excuses. That would be, so we've got, don't say I know.
Don't pretend like you know.
Don't pretend like you know, and be okay with saying, I don't know, or I didn't ask that, or, I didn't think to ask, something like that. And then when you're called out on something, don't make excuses. Own it. Own it. That there is nothing more impressive than if I say, hey, who sewed this chest tube in? And the student's like, hey, that was me. Sorry. My bad. Yep. Super cool. Because I'm like, oh, okay. I can trust you.
And these things are going to happen. Totally. For students listening, this isn't a rag on students. This is honestly what can you do or not do to be more successful on your rotations? Because you're not going to know everything. You're just not. I didn't know everything. There is not a PA student in the world who is going to come into a rotation and answer every question the right way, do everything that they're asked to do correctly. You're not. Right. So just be okay with that and set your bar high. I want to be a good student. I want to do the right things. I want to learn this, but be okay with saying, I don't know, not saying I know, doing these things that we're talking about, because as the preceptor, the expectation is not that you're going to come in and know everything. Right. If we thought that, you wouldn't be doing rotations. No. That's the whole point of it. Right. But I think some students come in expecting or thinking they know more than they do, and they want to try to show that off, and it ends up almost hurting them.
Right.
They end up leaving after 4 or 6 week rotation, and we're like, oh man, thank God that kid's gone.
If I see that kid's name again, not getting a positive reference for me.
Another one I'll think of, just in students who've had cell phones, and this is a common thing for anything.
We can't say your name, but cell phone.
There's lots of out there, but if you're listening, you are cell phone.
I'll it out. Don't worry about it. I've always wanted. This is a little aside. I think we need to have like a leaderboard. Yeah. With all of these things, because I think any PA who's practicing out there that's thinking of this is probably like, oh yeah, I know that person. I know this person. Oh, I know that person. So, but I'll bleep her name out, so it's okay. She would be on the list of like, not terrible. You know what? She's very pleasant, but
cell phone Karen.
Cell phone Karen. That'll work.
Karen
is on her cell phone.
Karen is on her cell phone. Probably every Karen.
That's right.
I don't even know what Karens are these days, but either way.
There's PA students out there named Karen, you're good. It's every other Karen we have a problem with.
The one I'm thinking of, and to her defense, was looking at, she was towards the end of her schooling and
she had a job.
Job interview, and she was on the phone communicating with that new place, but it was never ending, to the point where, you know what, it's one thing to say, hey, I'm expecting a phone call. Okay, I get it. You got to get a job. I understand. But it was 4 weeks of every time I would go to ask a question, and I'm not someone that likes to pimp students all that much.
Right.
But just a simple thing, hey, do you know about this, or you should know about that, every time on the cell phone.
Yeah.
Every time.
Yeah.
I was mind-boggled at the fact that, I mean, why are you here?
Right.
Why come here?
Right.
If you're, and I know I'm on my cell phone a lot. So are you. It's part of job. It's part of having a family at home and being on call. And I mean, it's part of life. But just put it away.
Right.
I put it away. You know, I think I don't expect people to not have their cell phones on them. You know, that's kind of an old rule at the hospital, right? No. Don't have your phone out. Like, don't do this, don't do that. It's okay to have it, but just be respectful. Like when you're doing rounds, it should be away. When you're in the operating room observing a case, put it away. Leave it outside.
Don't tweet about what you're watching here. Yeah. You know, that it can be a great reference. Like, I'm not opposed to people having Hippocrates, up to date, stuff like that. But when I remember this person that we're talking about, that, you know, we're making rounds and I come around the corner and Garner's sitting at the nurse's station, you know, doing notes, and she who shall not be named is like leaning back.
Yeah.
You're literally scrolling through Instagram.
Yeah.
So, and if you didn't already like our Instagram page, you need to go do that, unless you're on your rotation right now.
If you're on your rotation, it's okay. Do it real quick. No, just kidding.
We give you permission. It's fine.
If you're listening to this podcast while on your rotation, that must be really boring. That's rotation.
Next level. Like, meh. On the way to the rotation, sure. On the way home from the rotation, but during, probably not.
Yeah.
Okay, that brings me to another point. Like you were talking about our friend on her phone communicating with the job interview. That's the whole reason you go to school, is to get a job. So I get that. I'm expecting a phone call. I have a phone interview. I need to set this up. Totally fine. I get that. When it becomes another problem is when your personal life comes into your rotations. And I don't mean this in a condescending way, but it is going to come off somewhat rude. We all work really close together. We work so much together that we know each other well. We know details about each other's lives. We talk about our weekends, or how did volleyball go last night, or, you know, how's your dog feeling, or, you know, whatever. And so it looks like, oh, this is like a family. This is good. And when a student comes in and was like, you know, talking, especially at awkward times, about their own personal business, you know, or talking to people in the operating room as though they've known them for years. You know, they're mirroring what we're doing, which I get, but you're there to learn. Like, your job is to learn, and nothing is, I shouldn't say nothing is more off-putting, but it is one of the more off-putting things to be overly friendly talking about personal stuff when your job is to be learning.
I think it puts, when I understand what you're saying, especially as the PA in the room. I think what's the off-putting part of it, like you're saying, is that no one else in that OR, for us, for example, knows this person. Right. We don't really know the student either, but we're the ones spending the most time with them. We're spending
a lot of time with them.
We're putting kind of our name, our reputation on the line in terms of, this is my student. Like, everyone knows oh, that's the PA student with Chris. Right.
Yeah.
So no one else really knows you, so it's a respect thing, right? Like, hey, maybe I talked to Chris about this later, but I don't need to tell you that my sister's cousin aunt got divorced last week.
And she's crazy. And you'll never believe what she did last weekend at my grandma's birthday party. That's all great. And that's a fine one-on-one. Like if you have a good relationship with your preceptor, that's totally fine.
Yeah.
I guess I should preface, or I should say, be careful talking about your personal life in big groups.
Yeah.
You're sitting in a big office and you've got the scheduler and you've got the nurse and you've got the administrative assistant and you've got 3 PAs and 4 surgeons and you're yapping about your sister's boyfriend. Like,
less is more sometimes.
Right. And answer questions. If you're asked, like, hey, what'd you do this weekend? Go ahead and answer.
Yeah.
That's inviting the answer.
This may be another version of that type of scenario, but learning as a student to read the room.
Oh gosh, yes.
Read the scenario that's going on.
That should probably be number one. Yeah. We probably should have led with that one because that's huge.
I feel like it's a learned.
It is. It's not
a skill, but a learned thing that you in life end up doing. Right. As you get older, you figure out social situations, and not that. When I was 16, obviously you think you know everything, but it's kind of that same idea as you get older. But as a PA, and especially as a student, you learn when and when not to say or do certain things, right?
Yeah.
Learning in the operating room, when it's quiet, it's not meaning no one's talking,
right?
So it's time for me to talk,
right?
It's quiet usually because something's going on, right? Yeah. And you may not have a great view, you may not be able to see if you're just observing things like that, but learning to understand the situation, learning when it's okay to talk in front of a patient or ask a question. When, we have a serious conversation with the patient, let's say about a life or death scenario, not the right time to pipe up and start asking questions.
Yeah.
Correct? That sounds simple as an easy one, but those type of scenarios, as you go through school, you'll learn, okay, what's going on? And just be aware. Read the room, because when you say things at the wrong time, it's all people remember.
Right.
It's all that kid just wouldn't shut up,
couldn't read the room. That's literally what people have said. They're like, that kid can't read the room.
Yeah.
Figure it out. He's not welcome back in my OR.
It just it's one of those things where I think you just got to keep an awareness of, okay, what's going on right now? It's great to ask questions, to be engaged.
Yeah.
But to understand when to do it and the right way to do it and things like that, depending on your preceptor, depending on the surgeon, the doctor, whoever you're with, depending on the patient.
Yep.
What's going on?
Yeah.
Read the room.
Yeah.
That'll help you the most.
We have there's frequent times, at least in our operating room, in most ORs, where things are fine. Things are going fine and it's kind of lighthearted, and it might even be at a pausing point, where we have a second or two to chat. And so it's, maybe we're talking about something. So, hey, at this point of the case, this is what we're doing. This is what we're thinking about. This is what we're preparing to do. Well, then let's say the stuff hits the fan, and all of a sudden everyone is kind of busy and they're working. Just recognize that, and even if you were mid-sentence asking a question like, hey, what's this tube do? Or what would happen if you did this? And all of a sudden no one's responding and everyone's working. Chances are something's happening. Don't feel like you have to push the situation. Just hold on.
Yeah.
And hopefully they'll come back and ask you like, okay, sorry, what were we talking about? Let's finish.
Or make a mental note and ask later to make sure. I remember worrying that like people were maybe think I wasn't engaged.
Yeah, unless you're
because I was trying to hold back in terms of I don't want to say something and get my head ripped off by some surgeon or someone else. But then later, hey, when you guys were doing this part of the case, what was that?
Right.
Like, what did you mean? Oh, as a preceptor, I'm like, homeboy or homegirl was like listening or paying attention.
Right.
And read the room and knew that was the wrong time to ask what was happening.
Right. Yeah.
So make mental notes, write it down. If you're not scrubbed in or you're on rounds, write it down. Ask later.
Jot a note and, hey, when's a good time to ask questions or something. The other thing too is that silence doesn't always mean like, I have a hard time switching tasks. So if I'm, let's say, it's Monday. I wasn't on the weekend. I don't know all these people in the ICU. I'm reading notes and I'm trying to concentrate. Like, it is hard for me personally to like switch back and forth. So if you ask a question, you know, it's always good to be like, hey, is now a good time to ask or should I wait? Because if I'm reading through like multiple notes and seeing what different specialties are saying, I'm like, wait, what's going on? And then it just like, it's like walking through mud and I'm like, I don't know what to do. Yeah. So, but every preceptor is different. There's other people in our practice who are excellent and you can ask them, you can pepper them with questions and they're fine. So, but that's reading the situation. Okay, this guy doesn't do well when I do this, but this person might do well. So yeah, very good. Have you ever heard the expression, if your hoof beats, it's probably a horse? It might be a zebra, and it's almost never a unicorn. Have you ever heard that before?
No. I wonder if it falls in line with, like, I don't know, but we used to say, you know, refer to like a zebra type thing. Yeah. Probably a similar type idea. It's but probably explain, because I'm curious.
Okay,
now.
so yeah, that was something we learned in school, and it's like, you know, if you hear hoofbeats, it's probably going to be a horse, right? They're the most common animal that sounds like that, right? And it could be a zebra, probably not, but those are the less common things. So somebody comes in, they're sniffling, they've got a sore throat, they've got a cough. You know, the horse, let's say it's February and you're in the upper Midwest and it's cold outside. Yeah. It's probably a cold, right? Yeah. Common cold. But it doesn't mean you shouldn't think of other things. But I think a lot of times students have studied super hard and there's everything on the page looks the same, like it happens the same amount of time. So you'll read the common stuff and then you'll read the less common stuff and then you read the really rare stuff and it all's kind of jumbled in your brain. And you want to show like, hey, I did the reading and stuff. So the common thing is they have a cold. It's just a common cold. Now that doesn't mean you shouldn't check for the flu and stuff like that. But a less common thing, maybe a zebra, would be maybe they have a CSF leak. Okay. I suppose that's possible. It's way less likely that that's the cause of their clear drainage out of their nose. And like the unicorn would be like some heterozygous recessive genetic abnormality that
you read about last week.
That you read about in some sort of journal club. You know, like when people are like, well, you know, I read an article about this and how this happens and this is the incidence that this happens. That's great, but that doesn't help us in this moment right here. So it doesn't mean you shouldn't do your differential diagnosis, which is what else could this be? You need to think of those things, but as a student, don't feel obligated to push forth every bit of information.
Instead of mansplaining, you PA student splain.
Yeah. I call it student Tourette syndrome.
Student Tourette syndrome. Uncontrolled word vomit.
Yeah. Why don't we, let's see, let me think of an example.
I remember as a student, there was times where something would be obvious, right?
Sure.
What is this?
Yeah.
And you would give the obvious answer. And as a exercise, you were asked to think, you know, okay, now think outside of the box. What would a zebra be? That's what we what would this be?
Yeah.
90% of the time, that wasn't the exercise.
Yeah. Right.
So common things being common, that's what we always would say. Just the explanation needs to, or the answer should be X, Y, Z, whatever, not PDQ.
Right. It's general. I mean, and I get it. Like as a student, you do need to think of that.
Do you know what X, Y, Z, PDQ means?
No. Does it mean something? Can we even put it on this podcast?
That's what we used to say as kids. Examine your zipper pretty darn quick. That was
I do remember that. I don't
know why those were the letters that just came to mind. I mean, they're not even order.
It's more of a zebra, I'd say. That's kind of a zebra. X, Y, Z, PDQ. Yeah, so I call it student Tourette syndrome, which is like verbal diarrhea of everything you can think of about the situation.
To look smart.
To look right.
It's almost in that context to try to look like you know something.
So if you are asked a question in our world, a lot, you know, we give patients a big dose of heparin, and that's to thin their blood so that we can use the bypass machine without little micro clots forming. And so I'll say, why do you suppose we give heparin? The correct answer is to thin the blood while we go on bypass, or so the blood doesn't clot. Great answer.
Nailed it.
That please say that, hit a period, and we're done. But the student Tourette's version of that is, well, you want to inactivate the clotting factors to prevent thrombosis formation and stroke and reduce the incidence of stroke and PE risk with the circulatory system in the antegrade fashion. What the fuck does that mean?
Exactly.
Yeah, I wish that they would just stop with that. So I think avoid the student Tourette syndrome is kind of a joke, but it's to avoid the need to over-explain, or like you said, mansplain versus PA-splain.
PA student-splain.
PA student-splain. Don't feel like if you sense that maybe you're on the wrong track, don't compensate by going overboard with too much info.
I think most, like we said, obviously cell phone stuff like that is one thing. That's just common etiquette. But what it boils down to, in my mind, is it's okay not to know.
Yeah.
Students, I didn't know. I still don't know.
Right.
As a practicing PA, there's every day I get asked questions by patients.
Yeah.
I don't know.
Right.
And you learn to just be good with that. Hey, we're doing heart surgery and they're asking about something to do with, I don't even know, their foot. You learn to direct it back to a helpful answer. Hey, probably talk to your primary care doctor.
Yeah.
It's not that I don't care. I just don't know. And I'm going to not try to answer it.
I don't even want to guess.
Smart.
I don't even want to guess and be wrong. And I should probably stay away from that unless I have a history in ortho. I worked for a foot surgeon for 10 years. Then I could answer the question, but I haven't. So
be honest.
Yeah.
Honesty's the best quality. I mean, that's but a lot of things.
Protect your integrity with, don't say I know and then not do the same, not do the correct thing. Read the room, don't feel obligated to compensate for anything. I would say, to circle back to what we kind of talked about at the beginning, which is a lot of these things, I don't mean to harp on them, but a lot of these things are sort of a self-preservation technique.
Yeah.
I want to show that I'm smart. I want to show that I read the chapter. I want to show that I'm engaged. I want to impress this person. But really the most impressive thing and the best way to exude confidence is not to over-explain stuff, but to just say, I'm not sure. I don't know. To be so confident that you're okay saying, I don't know. Most people, if they're going to pimp you, they're going to ask questions until you say, I don't know. So don't dig yourself in a deeper hole.
Answer the ones you know.
Answer the ones you know. And when you get to one you don't, say, I don't know. Yep. And be okay with that, because that's why we're asking the questions. But there's nothing more confident than someone that's like, I don't know.
Honestly, it's a great question. I love that response. I don't know. It's a good question. Followed up sometimes by, I'll look it up.
Yeah.
And not that that's the expectation. There was times I was told, hey, look it up. They wouldn't tell me the answer.
Right.
Go home. Let's get a homework assignment. Go look it up.
Yep.
A lot of times you get the answer right away, but it's better to not make yourself look stupid.
Right. In the process.
Just be okay with understanding that you're not going to know everything, that you're here to learn. We're here to help you. We want you to succeed. We wouldn't take students if we didn't want you to learn.
Right.
So be open to learn.
Yep. Yeah. And I love teaching people new things.
Yeah.
And you're gonna look stupid, right? I mean, we've all been there where you're gonna say things that are dumb. You're gonna say things that are off track. But the pet peeves that we're talking about here, that's what's gonna leave us with a good taste or a bad taste.
Yeah.
If you're like, look, I made some stupid comments, but I learned from it and I was reasonable, great. But if you're like harping on everything, it's really hard.
This isn't even a pet peeve thing. This is just as a student, I feel like we're obligated to say this because no one told me as a student, and then you learn that it happens all the time. When you go talk to a patient, they're not going to tell you something, and then the preceptor is going to come behind you, and they're going to get a totally different story.
Totally.
And we know that.
Yeah.
That's almost like, just if you know that's going to happen.
Yeah.
You don't need to go all of a sudden and be like, hey man, hey Dr. So-and-so, oh my gosh, they totally did this. We know.
Yeah.
Patients are terrible historians.
Right.
I don't know but be okay with knowing you're going to go in and ask questions and all of a sudden something's going to be different said.
Right.
You don't need all of a sudden
The student goes in, gets a story, comes back out, kind of does a little presentation, says, here's what's going on. Then I go in there and I say, so I know you talked to Joey. Sounds like you had a fall yesterday. Oh, no, I haven't fallen. Okay.
Yeah.
So tell me what brought you here. I just skip over it. And poor Joey's like, no, they told me that they had a fall. And then, no, I wasn't lying. And it's like, no, don't even worry about it.
Don't even worry about it. As a student, if you know that's going to happen, you will expect it. Just expect it because it's going to happen. And everyone in medicine knows that's how it goes. If you ask any doctor in the world, any PA, it's happened to them a million times in training. And then now that they're the preceptor, it's just expected.
Yeah. It happens now. I mean, I just recently walked into a room, had a conversation, ran into the surgeon coming down the hallway, and I was like, hey, here's what's going on with this one. This is what's happening. And then I was like, here, I'll just go in with you. We went in together. Completely different story than what I heard. You know, when I was in there, everything was fine. No worries. Everything's great. Surgeon walks in, horrendous pain. The nurse is terrible. All these things. And we walk out, and he just looks at me, and he's like, and I was like, listen, you know how it goes. And he's like, it's fine.
Yeah.
I didn't make it up, but the guy was smoking and joking when I was in there. But I think we don't mean to harp on things. I don't mean to make people feel bad. These things are going to happen. So just in the back of your mind, if you're a big personality, just be a little bit reserved, and certain preceptors will invite that out in you, and that's all good, right?
Yeah.
Like, hey, what did you do this weekend? Talk to him. You're a human being. We get that. But it's the people that can't read the social cues, or people that are prideful, that are, I know this already. Or, you really shouldn't prescribe that medicine because of this side effect with it. I do this a lot. Like, ask the question, hey, do you ever worry about this condition? Do you ever worry about this interacting with this? Perfectly fair question. But when I come out of a room and you're like, you really need to be careful of doing that. I'm glad you read it in a book, but the actual medicine is so different than what the book says.
Yeah.
So it's all part of the learning curve, but hopefully this is, not offensive, or hopefully it's not, we don't mean to hurt anyone's feelings, but these are things that separate, the great students from the okay students, and the medical community is pretty small. So when it comes to getting a job, if someone calls up and says, hey, Garner, I saw that this student rotated with you. What'd you think? If you're someone that's kind of gotten stuck in these pet peeves, it's a hard reference to give. If we're like, had a little trouble reading the room, had a little trouble taking direction. That's not a good selling point. But if you're like, you know what, they were great. Like, they went home, they looked stuff up, they came back the next day, they were respectful, they were, those are all wonderful, wonderful traits. Once you're working and you are, you're established, then you can do whatever you want. Yeah. You can be a big personality, a little personality, whatever you want. But as a student, every day is a job interview. You have to remember that. You can't get so laid back and think that like, oh, I'm just going through the motions and man, I'm one of the team already and this is all good. It's a job interview. So how would you act at a job interview? That's kind of how you have to act every day on rotations. I think that's it. So if you guys disagree or agree, leave a comment below. Don't forget to like and subscribe our podcast. Come on, I forgot to mention that at the beginning. Like.
Hit the bell too. The little bell
notifications. Slam that subscribe button. We want to get some subscribers, so you know when the new episodes come out. But we got a lot of cool stuff coming up. So I'm looking forward to it. We will. We'll just check back with you on the next episode of our podcast. Sound good?
Mm-hmm.
All right. See you.